Heart failure occurs when heart is not able to pump enough blood for the needs of the body. Heart failure can also occur when the heart is not able to relax properly to receive blood so that it can pump out well when it contracts. The former is technically called heart failure with reduced ejection fraction, and the latter as heart failure with preserved ejection fraction. Ejection fraction is the fraction of the blood within the heart which is pumped out when the heart contracts. Risk factors for heart disease can also contribute to heart failure, as heart failure is the final common pathway for any severe heart disease. Important lifestyle factors in this context are smoking, being overweight, excess amount of fat in blood, and sedentary lifestyle. Diabetes, a predominantly lifestyle associated disease, is an important risk factor for heart disease and heart failure. The most common disease which causes heart failure is coronary artery disease, in which there is accumulation of fat deposits within the blood vessels of the heart. This may initially cause chest pain on exertion, known as angina, and sometimes a heart attack. Heart attack damages the heart muscle and causes heart failure. Heart attack usually occurs when there is total blockage of a blood vessel supplying oxygenated blood to the heart. The technical term for heart attack is myocardial infarction. High blood pressure is another important cause for heart failure. Very high blood pressure makes it difficult for the heart to pump blood and leads to heart failure. High blood pressure, known as hypertension, can indirectly cause heart failure by increasing the risk for a heart attack. Good control of blood pressure can prevent heart failure due to hypertension. Diseases of the heart valves is yet another important cause for heart failure. Abnormalities in heart valves may be present at birth or acquired later due to certain diseases. Rheumatic fever is an important cause of heart valve disease in children. Diseased heart valves can be either leaky, obstructed, or a combination of both. Diseased heart valves increase the workload of the heart, leading to heart failure later. Heart valves can also get damaged as age advances due to degeneration in the elderly. Heart muscle disease or cardiomyopathy leading to heart failure are generally of three types: dilated, hypertrophic, and restrictive. In the dilated variety, the heart muscle is flabby and contracts poorly. Hypertrophic variety is characterized by undue thickening of the heart muscles, making it difficult for the heart to relax and receive enough blood to pump out. Restrictive variety has also difficulty in relaxation. Another important disease of heart muscle is inflammation, known as myocarditis. Myocarditis can occur due to infections caused by viruses, bacteria, and other microorganisms. Some vaccines may also be associated with myocarditis as an allergic reaction to the heart. Excessive use of alcohol can weaken the heart muscle. Birth defects like holes in the wall between chambers of the heart increase the workload of the heart and lead to heart failure later on. An abnormal communication between the largest blood vessels, aorta, and pulmonary artery can also increase the workload and cause heart failure. This communication is known as patent ductus arteriosus, or PDA in short. Severe lung disease increases the blood pressure in the blood vessels of the lungs. When the pressure goes very high, the right ventricle fails. Right ventricle is the lower right chamber of the heart which pumps blood to the lungs. Failure of right ventricle secondary to lung disease is called cor pulmonale, Cor means heart. Pulmonale means related to the lung. Severe anemia, low levels of hemoglobin in blood, grossly increased function of thyroid glands, and severe abnormalities in heart rhythm can lead to heart failure sometimes.
Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.